The brace is off and you're now in the retention phase of your orthodontic treatment. In this video, you'll be guided through the important instructions you must follow in order that your teeth stay straight and in their current position. As you'll have been told when you started treatment, you'll need to wear your retainers for as long as you want straight teeth. This is because there's a tendency for teeth to move throughout life. So if we want to keep them straight, we need to carry on wearing our retainers. Teeth almost have a memory where they want to go back to the positions they were in before treatment. So by wearing your retainers, you are resisting that relapse. But there's also a second important point as well, as teeth tend to get more crooked with age naturally. So by wearing your retainers, you are also resisting that aging effect on your teeth. You will need to wear your retainers between 9 to 12 hours a day. So most people wear their retainers at night to keep their teeth steady. However, if you're new to wearing your retainers or have recently had a new set of retainers that may feel tight, it would therefore be recommended that you wear your retainers during the day as well, just until they feel more comfortable. This could be anything between just a few days up to a couple of weeks. During this period, it's important that you remove the retainers, however, for eating and drinking anything other than plain water. The important thing to monitor is that the retainers should always feel comfortable and not overly tight. If the retainers are starting to feel tight, then it means that you aren't wearing them enough and the teeth are trying to move. You should therefore increase the amount of hours that you're wearing your retainers for. When the retainers are not in your mouth, they should be kept in a protective box with a clip-down lid. Never put them in your pocket or on the side. It's so easy to lose them or break them, and not only will this result in costly replacements being required, but the teeth may also start to move if you're unable to obtain a new set straight away. It's important that you keep your retainers clean, and you can do this by either brushing them, soaking them, or using a combination. If brushing the retainers, you should hold the retainer on one side and support the toothbrush in order to avoid flexing the plastic and accidentally cracking it. Please do not use toothpaste to clean your retainers, as it turns the plastic white over time. If you're using a retainer cleaning product like Retainer Bright, please ensure that you're following the manufacturer's instructions on the box. Also, it's important that you must never put your retainers in hot water. The plastic will warp instantly and they will no longer fit. Another common problem that can be experienced is cracking of the retainer due to incorrect placement and removal. When seating the retainers over the teeth, you must never bite them into position. You must always ensure that you use finger pressure to ensure that they're fully seated down over the teeth. When removing the retainers, you should also lift the retainers down at both sides of the mouth first at the back. Removing them from only one side in the same place will cause them to crack. If you do have any problems with your retainers, please inform us as soon as possible so we can offer you advice and help. But please note that unfortunately, you may have to pay a fee to cover the additional cost of your replacement retainer if you've broken it or it does not fit you now due to you having not followed the retainer advice and instructions. Handled with care, your retainer should last you several years before needing replacement. But as with everything in life, they will wear and need replacing at some point, and therefore you should anticipate needing new retainers in the future and the cost of these. Of course, you should always make sure that your teeth are always beautifully clean before putting in your retainers. If you also have a bonded retainer, you will need to spend longer cleaning around this retainer to ensure that you do not get any buildup of plaque or tartar, which could cause gum problems and tooth decay. So in summary, you must wear your retainer every night, but you should wear them more often if they start to feel tight or if they're tight at the beginning of your retention phase. You should keep your retainers in a protected box when they're not in your mouth. You should ensure that you clean and handle your retainers with care in order to avoid costly replacements. And you should inform us if you have any problems at all so we can help. So that's it for now. We'll be in touch in around 3 months' time to check that you're doing okay with your retainers, and again in about a year before we discharge you back to your own dentist. If you do need to attend the clinic to see your orthodontist at all in the next year, please don't forget to bring your retainers with you. It's also recommended that now the brace is off, that you see your own dentist for a checkup.